Hi, my name is Aisha Lubega, and this is my culturally competent teaching presentation. The scenario which I drew from was SJ, who came to my office because he realized that his blood sugar was getting out of control and he needed assistance. SJ falls into the developmental category of the middle age or the baby boomers. These individuals can learn in different ways and are well versed. Some of the cultural considerations in this scenario is the fact that SJ is a recent immigrant from Haiti. And due to the fact that he's not accustomed to the culture in the U.S., it is important to consider some cultural aspects which might influence his care. Communication is key in all situations. Generally, patients do not maintain eye contact when speaking with those in a position of authority. Therefore, do not interpret lack of eye contact as not listening or not caring. It is important to ask family members to assist with interpretation only if an interpreter is not available. It's important because Haitians are very private and thus it is inappropriate to share their information. The use of touch is a way to make you aware that they are speaking to you, so do not take offense to a casual touch on the arm or the shoulder. Some of the family roles which are played are the fact that the head of the family has traditionally been the man, but today most families are matriarchal. Generally, the man is considered the primary income provider for the family, and he usually makes the decisions. Women are generally expected to be honest, respectable, and faithful. Children are expected to be respectful, obedient to parents and older people. They are also expected to be high achievers. It is important to include family members in the care of loved ones to achieve trusting relationships and compliance with treatment regimens. Some of the health practices which are followed. Good health is viewed as the ability to achieve internal equilibrium between chill and fray, which is hot and cold. Promoting good health requires being strong, having good color, being plump, and being pain-free. Balance requires eating well, having good hygiene, praying, and have good spiritual habits. Illness can be perceived as punishment or considered an assault on the body, which may have two different causes, natural illnesses or supernatural illnesses. Some are the nutritional cues which should be considered. They prefer eating at home and they discourage fast food. It is recommended to ask family members to bring food from home to the patient. There is an emphasis on hot and cold, acid and non-acid, and heavy and light when discussing food. There is great emphasis on keeping a balance, and not doing so is believed to result in illness. Sometimes eating properly could mean eating to the point of being full and maintaining a constant body weight. Weight loss can be seen as one of the most important signs of illness in this culture. Some of the high-risk health behaviors of the culture. Alcohol plays an important part in society and is culturally approved for men. Cigarette smoking is practiced by men. Women have a very low rate of tobacco use. Other high-risk behaviors which could be viewed are non-use of seatbelts and helmets when driving, or using a motorcycle or a bicycle. Usually, these safety measures are not used in Haiti. Some of the beliefs. Belief in the power of the supernatural can have a great influence on the psychological and medical concerns of the client. This extended family is a great source of strength to most in this culture. It is important to recognize and accept clients' beliefs in order to alleviate barriers and to make the clients more at ease to discuss their beliefs and needs. Some of the depth and spiritual beliefs. Some practices of spirituality involve Catholic religious beliefs combined with Buddhism, with its roots in Africa. Buddhism involves communication by trance between the believer and the ancestors, saints, or animistic deities. Believers in Buddha attribute some of the ailments or medical problems to the doings of evil spirits. Are there any questions? This in no way is inclusive of all people in the Haitian culture, but it gives you a glimpse of what some of the culture might believe in. I hope this was beneficial, and thank you so much for watching my presentation.